About 120 pupils from 2 different schools in the Eastern Cape were rushed to various hospitals yesterday, apparently, for food poisoning. The Provincial Education Department says they showed various symptoms, including itchiness, shortness of breath and fevers. The first incident was in Mlungisi, where 34 pupils aged between 8 and 15 were transported to Frontier Hospital in Komani. More cases were then reported from other schools in the area, from another school, I should say. Let's get you the latest, what we know. Joining us now is Dr. Sizwe Kupelo, who is the spokesperson for the Department of Health in the Eastern Cape. Dr. Kupelo, it's great to talk to you. Thanks very much indeed for coming on. What do you know about what happened?
Yes, indeed. We managed a number of learners who came to Frontier Hospital in our emergency vehicles yesterday. Clinical tests were conducted, and they had a history of having consumed various items, which included frozen drinks, muffins, and the so-called shwam. And they were managed, and health and environmental officers from the Chris Hani District Municipality as well as the Department of Health also came on board to conduct further investigations on the incident. Toxicology tests are also being conducted. I must also mention that a group of 50 were successfully managed, but later in the late afternoon, just after 6, a 14-year-old girl arrived in a rather serious condition. She is currently being treated at ICU, also at Frontier Hospital.
So are you saying it's yet another case of children buying cakes, cookies, different things to eat from vendors near to the school? Is that what you think happened here?
Yeah, based on the history given by the learners themselves to our clinicians, that is the case, because some of these items were allegedly brought from a hawker from outside the school, which calls for regular inspections on items being sold to members of the public. But we also want to caution and urge members of the public to always check on the sell-by date on all the items that they wish to consume.
I mean, we've had children dying as a result of consuming food from vendors, right? Be it expired food. There are several other investigations that are underway to determine exactly what the cause of death would have been. But there is one common link, right? It's that just in the moments before they got sick and in some cases passed away, they had consumed food bought from a vendor. The Minister of Health has said that there just isn't enough in terms of resources to get health inspectors out to monitor each and every site where vendors operate. But what's going to happen in the absence of more inspection, in the absence of more accountability?
I think all of us as members of the public, we also have a responsibility to ensure that anything we consume and also ensure that we maintain high levels of hygiene. But in this particular case, already there's a team that's seized with the issue and conducting investigations. Toxicology tests are being conducted, and I assume that stools would be taken as well as part of such an investigation. But generally, members of the public, we urge them to also ensure that they play their part to minimize the impact of these cases.
I mean, surely you're not saying that the children themselves, because when you talk about members of the public, who do you mean, Dr. Kupelo? You don't expect surely that these 8-year-old children are going to exercise caution?
Children would have been involved, but you'll find that it is the adult who may have prepared some of these items which ended up with the children. So those adults are expected to take risk, especially people who are going to handle food. Yes, government has a responsibility to ensure that resources are enough for such inspections to take place as well.
So what is the way forward now? Because it's been, I mean, we've had consecutive weeks of these kinds of incidents emerging. Outside of appealing to the public to be more cautious, what is the plan now? Is the plan to perhaps for the moment put a moratorium on vendors selling outside schools until we can figure out a better way of doing this?
I would imagine that there's a long-term solution to the problem. There's a great need for massive awareness, mobilization of resources to ensure that challenges such as these are addressed, and we arrest any such occurrences as they happen.
It doesn't sound like you have a plan, Dr. Kupelo.
No. Remember, I'm here to talk on what happened on the specific case, but I'm just also highlighting what may need to happen based on the history given by the patients on admission as of yesterday. Other policy matters would have to be addressed by relevant authorities.
That does not inspire confidence at all. But let me thank you for your time this morning. Dr. Sizwe Kupelo is the spokesperson in the Eastern Cape Health Department. Consecutive weeks, as I say, of incidents exactly like this one, where children consume food, fall ill, and in some extreme cases even die. The National Health Department, the Minister has already said that there just isn't adequate supervision or inspection of these shops, and that it's not being prioritized by municipalities. What is the plan? Unfortunately, we don't have that answer for you this morning.